Okay, we're live.
Okay. All right, thanks for being here again, folks. We're going to try to do these briefings once a week and then as needed after that. But we started with 2 a week, and we haven't had quite enough news to fill 2 briefings a week, so 1 week seems to work. We have tested in Lewis County 270 people for the COVID-19 virus. If you look at that in terms of a per capita percentage, we are right in line with others in our region, similar to Jefferson County, Oswego County, Herkimer County. So we've been doing an adequate job with testing. We have 11 confirmed cases, but the best news is 8 of those 11 people have recovered. So that is truly good news. We currently have 33 people in quarantine. We're doing good with the social distancing. We need to continue that, obviously. Mask distribution. We have given out in Lewis County over 2,000 masks. That is phenomenal. And these are not masks that were purchased by the county. These are masks that were made and sewn by our community members, which is just fantastic. We have had churches, sewing groups, quilters, Boy Scouts. Our wonderful background here was made by a quilting group that got together and made masks. So some of you are walking around with masks from some of the most talented sewers and fabric workers in all of New York State. So awesome job to everybody, and we're really helping the community become safer. So we still have mask distribution for next week, Tuesday the 28th from 11:30 to 12:30. We'll be at Cliffs in Port Leyden distributing masks. And at the same time, Tuesday the 28th from 11:30 to 12:30, we will be at Stewart's in Copenhagen. So Cliffs in Port Leyden and Stewart's in Copenhagen next Tuesday from 11:30 to 12:30. Next Thursday the 30th from 11:30 to 12:30, we will be at Sliders in Krogan and Stewart's in Harrisville. So we're trying to get to each region of the county and do some mass distribution there. But there's a big caveat with that. All of this mass distribution plan depends upon people continuing to donate masks. We have had an unbelievable outpouring of masks, but we need more. We still need more. When we have done our 2-day giveaway where we're at Tops in Lowville and Walmart in Lowville this week, we gave away all our masks in the first 30 minutes. And we had people that weren't even coming to shop at Tops and Walmart. They just came to pick up their masks. So it is important. It is part of the governor's executive order to be wearing a mask if you're in public and where you can't be observing social distance. So it's important that people do that. And please keep sewing. The economic impact obviously is becoming hard on a lot of people. There's a lot of people out of work. This is an unprecedented time. But I do want to announce that New York State has made signing up for a little extra help for some benefits as easy as ever before. They have the New York State mobile document upload. Okay, basically this is something you can download on your smartphone, take a picture and fill in the applications from a mobile device. You can call DSS and they can help walk you through it, but you don't have to come in person, you don't have to leave your home. And I just want to talk about the importance of these programs, especially for some folks that may be facing joblessness and some hard times for the first time. Here are the programs that we have available in Lewis County. SNAP is a program for, it's called the Supplemental Nutrition, what's the A stand for?
Assistance.
Assistance, yes, that's right. Supplemental Nutrition Assistance Program. Basically, it helps you with your grocery bill. And if you are already enrolled in SNAP, automatically all of your benefits that you'll receive this month have been increased to the maximum threshold for your household. So that was automatically done by the state of New York when we went into this crisis, or the federal government, I should say. So that has already been taken care of. Heating assistance, or HEAP, that is the last day for HEAP heating assistance is today, actually. Today and tomorrow. So if you need to refill your furnace, your oil, whatever it may be, the last day to do that is tomorrow. Temporary assistance. This is cash assistance for families. It's families with children. This is not available for everybody, but if you have children in the home and you need cash assistance to keep them safe and to keep your household going, you can apply for that through the New York State Document Upload or call DSS, and they will help you out. And then of course Medicaid, a lot of people who had insurance maybe through their employer no longer have that. You may be eligible for Medicaid, so you want to log on to the New York State of Health, and that's where you can answer a few simple questions and determine if you're eligible for Medicaid. So certainly a global pandemic is not a time for people to be without health care and health care coverage. So log on to New York State of Health and get yourself covered through that program. Last thing I want to mention is the Dairy Drive. We are putting together with Cornell Cooperative Extension and the Farm Bureau of Lewis County a dairy drive-through tomorrow from 3 p.m. to 6 p.m. at the Lewis County Fairgrounds. We have 500 gallons of milk. We have cream cheese and string cheese and sliced cheese. We have kielbasa and masks also. So how it's going to work is you drive up you come in through the DeWitt Street entrance. Okay, it's going to be a one-way traffic flow through the county fairgrounds. We'll have a staging site there. We'll have a bag prepared for you with a gallon of milk, some of the dairy products, some meat, and a mask. And when you drive through, there will be no interaction with the public or the volunteers that are putting the baskets together. We'll have you pop your trunk. We'll place the items in your trunk, close your trunk, you drive off. You don't have a trunk, we'll put it in your back seat, you drive off. So no interaction, we're maintaining social distance the entire time. This is a drive for anyone, okay? It's important for our farmers that we're able to move some dairy products off the shelves to make room for new ones. The stuff expires and the cows keep producing milk, so it's important for the supply chain that these items get moved. It's also important for the community that we're providing some free products to help support your family at a time when the economy is not at the best. So that is tomorrow, 3 to 6 at the fairgrounds. Come in the DeWitt Street entrance and you'll leave the Boswick Street entrance, and we'll have everything set up, and we'll just drop the products in your car. You continue to drive on, and it's a wonderful event. I do want to thank individually our sponsors for the Dairy Drive. First, this was a brainchild of the Lewis County Farm Bureau. They're the ones that had the idea to do this, and they have spent $500 at the Loudville Producers Store buying cheese. So that's cheese that supports our local farmers. We have Cornell Cooperative Extension has pretty much been the boots on the ground for this. They're the ones that have done all the logistics work along with our county emergency management team, putting that all together. Kraft Heinz donated string cheese and cream cheese. The American Dairy Association Northeast is the ones who donated 500 gallons of milk. Autumn Ridge Goat Farm has donated goat cheese. Great Lakes Cheese and Adams has donated sliced cheese. Adirondack Beef Company has donated kielbasa. There's 100 pounds of kielbasa that we'll be giving out on Friday. And then we have to move these products, of course, from where they are to the fairgrounds and keep them cool. And so Black River Valley Natural, Cummings Creamline Milk, and Woodrick Electric have all donated refrigerated trucks, and Woodrick's donated a trailer so that we can move the products and the pallets and keep everybody safe by keeping them cold, the products cold and at the appropriate temperature throughout the distribution. Cornell Cooperative Extension, as I mentioned, Lewis County Emerging Professionals Group is providing volunteers for the event on Friday. County government, we're providing, some of our employees will be there to help with distribution. Lewis County Sheriff's Department and Loudville Police Department will be on hand for traffic control, making sure everybody's moving through the line efficiently and safely. And of course the Lewis County Agricultural Society, which is letting us use the fairgrounds as the staging site. So that is my update for today. I'll turn it over to Jerry for some updates from the hospital.
Okay, thank you, Ryan. My prepared remarks will really focus on giving thanks. I'd like to thank the many individuals, organizations, the faith-based communities, the Lewis County General Hospital Foundation, the Lewis County General Hospital Auxiliary, for their generosity and support over these many weeks of the COVID-19 experience. They have provided many sandwiches, pizzas, salads, sweet treats, and masks to the many employees of the health system. And it's gratifying and rewarding. I've been able to thank some personally, but the list is expansive, and I wanted to use this forum as a way of expressing my deep gratitude for their generosity and support. With that, I will just open it up to questions that you may have.
Okay, Jerry, do you guys have any kind of plan yet to reintroduce the elective surgeries at the hospital? Given the governor's announcement earlier this week, it looks like maybe next week that process can start up again in certain counties. So what's your understanding at this point?
Yeah, we are going to be ready to go. The team has been working through the logistics of what needs to occur for us to begin surgeries again on Tuesday, April 28th. And there are a few things that we need to sort of check off the list. We had to meet a certain bed capacity that would be available. We've been able to do that because our overall census is down, and with the exception of the first 2 positive cases in Lewis County, we've had no positive COVIDs in our medical surgical unit. 2, that there are no more than 10 positive admissions in the hospital. Well, based on my first answer, that hasn't been an issue. And 3, that every surgical candidate goes through a COVID testing process. And based on the average length of time it takes to turn that around, we're planning on 3 to 4 days prior to surgery for that testing to be accomplished. Then at this point, within those cases, there's a sort of review of priority. Because as you can imagine, between the general surgeons, the orthopedic surgeons, and the OB/GYN physicians, they're all chomping at the bit to get back in the OR. So the team is working through the schedule right now. So we're going to be appropriately staffed. We're going to continue to follow all the social distancing and screening tools that we've implemented well before it was fashionable, so we can assure our community members that they will be safe and well cared for and supported through the process. So next Tuesday.
So with the testing that you just talked about, one of the requirements is that before somebody has an elective surgery, they have to go through the COVID-19 test.
Yeah.
You said it's likely a 3 to 4 day turnaround sometimes with that. So does that kind of defeat the purpose of testing them before the surgery? And also, we had talked, I think last week, about whether the hospital would be able to do on-site testing at some point, and is there any update on that? Because that might help that situation a little bit.
Right. So we continue to work to get on-site testing, well, probably more important, on-site testing with rapid turnaround. And when you look at where the COVID cases are, and when you look at our size on a statewide priority list, we would be towards the bottom. So, you know, pragmatically, we're working hard to have that here. I believe at some point in the future we will, but there are larger organizations dealing with greater needs and issues than we are. So it'll come, but it'll be more time. 3 to 4 days is what we're projecting, because if we have somebody prepared for surgery and the test doesn't arrive, Some of our experience recently is 2 to 3 days, but that everything has to fall into place perfectly. So we're talking 3 to 4 days. I mean, you can imagine if you're prepping for a colonoscopy and the test doesn't arrive in time after you've done all of that work. So that's what we're thinking right now.
So with that, the patients are being tested before surgery. How about staff? Do they need to be tested before they'll have PPE on, but still?
Yeah, they will have PPE plus for well over 6 weeks we have been screening and taking temperatures, and for several weeks been issuing face masks for every single person entering the campus. So we're going to continue, and I appreciate the question. At the end of the day, I think we've had a total of 11 positives. Now one could argue, you know, is there more opportunity and more room for surveillance testing? Absolutely, but that'll come in time. But out of all 62 counties, we're in the top 1 or 2 with regards to the positives. And as Ryan was mentioning early, our ratio of testing to population is in alignment with other counties. So we're doing pretty well there.
Okay, great.
Yeah.
Carthage Area Hospital has a similar number of staff, not differentiating full-time to part-time, as Lowville, but they managed to get the PPP grant or loan. I know we had talked about full-time equivalents versus raw numbers, and the part-time makes a larger number, so it's in the 650 range, where PPE was just over our full-time equivalent just over the threshold. Any chance that on this next round of funding, Lewis County Hospital might be included?
Only for the PPP program. We have 2 programs that we have submitted applications for. One is very small. It's the foundation, which has a single employee. The other is larger, and that is we call it the PLLC. It's the organization where our employed physicians are housed. So we've applied for that, and that's a meaningful number because one, I don't know the exact number off the top of my head, but we meet the thresholds. The hospital campus, and for the program, the identifier is your tax ID number. And in our tax ID number, we have the hospital, the nursing home, home health, and hospice. So that tax ID number has more than 500 employees. We're actually at 653. And our FTE count on those employees is 504. Okay. Simply being over the 500 threshold makes us ineligible. Carthage is less than the 500. So
with a full-time equivalent.
Yeah, I don't know what their count is, but they are less than. So they applied and were approved, and as a result, you know, they were able to invite the employees they had furloughed a week ago back to their hospital campus. So that's significant. I mean, that's terrific for them that happened. And as I shared last week when we were having the furlough conversation, if we would have been eligible for the PPP, we would not have had to move with the furlough action.
With elective surgeries coming back, do you think that the furloughs might not last the full 8 weeks, or do you think they might have to be extended beyond 8 weeks?
Everything we have worked from is we will not extend beyond 8 weeks. However, the timing of getting the news for the elective surgeries, our plan was initially to have 35 individuals or FTE equivalents furloughed. We were able to drop that, and the actual furlough process led to 30.4 FTEs. So that's because we have to gear up for the elective surgeries. Now, having said that, I think what will happen, it isn't going to be a switch is turned one day and everyone comes back, but rather as the activity is occurring and there's more downstream work from that activity, then we will start calling people back. So I would be shocked if all 30.4 FTEs were on 8 weeks worth of furlough. I think you'll see this change over time. But it would not surprise me if some are furloughed for the full 8 weeks.
In real numbers, the FTEs, how many people are?
Yeah, you know, I should have anticipated you would ask me that question. And I didn't do the count before, but if you want to check in later, I can give you a head count.
Okay.
Right, because some are part-time, some are sharing.
Right,
so
right.
It's more than 30 people, but the equivalent is just a hair over 30.
Only we could do that with age, just stack it neatly in a different way and get 5 years off. Right?
There you go.
Ryan, we had some questions yesterday when we put out the thing on the dairy drive. So with the drive actually being at the fairgrounds in Lavo, right in the village, a couple people were wondering that, you know, they don't have access to a vehicle, they walk everywhere in the village. Will walk-ins be accepted at the fairgrounds for the dairy drive? Or is it just you have to be in a vehicle?
I don't know. That's a good question. We will have to follow up with Bob McKenzie, and he's handling the logistics, and Michelle Ledoux at Cornell Cooperative. We can get that information out between now and tomorrow. I think that would make sense to have an availability to walk. However, putting pedestrians in the same line as cars is not a smart thing, so I will say probably yes, there'll be a way to do that. I just don't know the logistics, so we'll figure it out. But good point, I didn't think of that. Yep.
Okay.
We also have Ashley Waite is with us, the public health director, and Jake Mosier, our county clerk, is with us today. So we wanted to give these guys an opportunity. Ashley, any updates from your perspective?
You did a good job covering all of my updates.
That's good, because we've reviewed before. Jake, anything you wanted to say, or just here for some questions?
I guess first I'll open it up to questions, because I'm guessing there are quite a few questions based on last week's press conference. So I'll just open it up to questions first, and then hopefully my statement's covered within the questions I get here.
Okay, well, I know that you kind of wanted an opportunity just to let, I think if it was last week's press conference or the week before, one of them, I had brought up a question that had been presented to us a number of times with people wondering, you know, without having access to certain services and things like that, was the county considering furloughing any employees? So I think you kind of wanted an opportunity to explain, like, the process is still going on at the DMV, so even though they're not personally like dealing with people in person, they're still doing all the work and the processing and things like that. So you can submit your paperwork through the mail, online, etc.
Yeah, in all reality, 90% of your DMV transactions can either be done either online or through the mail. We've been directing residents to do through the mail because, of course, the county gets to keep 12.7% of that transaction. And of course, you know, we keep talking about budgets and everything else, and this time especially, you know, if you're willing to wait a few days for your mail transaction, that extra 8.7% really does add up at the end of the month. My department, like you know, like some other departments, believe it or not, we've actually been full staff since this has started. Within the clerk's office, we were fortunate enough that I've reaped the benefits from my predecessors, that we have a computer system in, and that we have been ready to be able to go remote in case of emergency within the office since we brought in the different computer systems. And honestly, just early on, it was just, you know, connecting the dots, getting everything dialed in, so that I actually, within the office on day-to-day, it's me and another staff member, we're there to either answer the phones, because what a lot of people don't realize is the county clerk's office actually becomes what seems to be the county switchboard during times of need and when people have questions. So we're directing a lot of calls, and of course, because I oversee the DMV, we've been taking a lot of DMV questions at the office. With banks deemed essential, of course, land recordings and mortgages, they've slowed down, but they haven't stopped. So that's where I have my 2 remote staff members able to come in remotely utilizing our e-recording system from home with that. So actually the clerk's office, we've only really been able to not do is 2 transactions, and that is any transaction related to the court system, because the courts are closed as of now, and then of course passports. Passport office, I have been in contact with them, and we do have the go-ahead to do applications, but like they said, their main office is closed, so it doesn't really pay for our office to start the application because it's not going anywhere anyway. We're not allowed to mail it to the passport agency or anything. It'd just be sitting in our office. So.
Okay. And on the state level, can you just kind of explain to people a little bit, has the DMV implemented any policies that kind of relax some of the, I think we read somewhere where maybe inspections, like if your inspection sticker is up, it's still valid until.
Yeah. So if you had any expiration from March 1st on, you are covered under the latest executive order. So that goes under your license, your registration, and even vehicle inspections. They're all covered from the March 1st deadline on under the latest executive order, which, what's that, March 15th? That's what it takes us out to right now. So right now, and we're expecting to hear from the DMV commissioner. The County Clerks Association has committees that talk to the commissioner of the DMV every day, and we're just waiting to hear of how many days after the COVID pandemic that they're actually going to extend these deadlines out. Because as a Clerks Association, our worst fear is that when things start opening up, that they're not extending these deadlines, and it's putting the residents under pressure to quickly get to our offices to get their renewals done.
Okay. And so say if your vehicle registration expired on March 1st and you're not able to come in and get it re-registered until May 15th or whenever things are required again, would that go retroactive back to March 1st?
Most likely, yeah. What it would do is it would go retroactive. We're also working on that, but generally when your vehicle registration comes up, it is retroactive to when it was supposed to be anyway. Only thing that doesn't a lot of times go retroactive are vehicle inspections. So if you're over date on your inspection, that would be effective the date your vehicle gets inspected at a garage.
Okay.
I'd like to ask Ryan, thank you, Jake. So with the topic again of layoffs or furloughs on the county level, has there been any more thought about that? Is there a threshold of time whereby extra funds that aren't being used for some programs can be used to support others? Is there that flexibility? Does that need, how's it work? How can you shift the shelves, so to speak, to accommodate what's happening now as opposed to what we thought would happen right now budgetarily?
Yeah, so we talked, we had committee meetings on Tuesday, and I gave an in-depth briefing to the Board of Legislators on the situation with the county sales tax. So when you talk about the financial implications for us, there's 2 things that are worrisome. The first is sales tax. That makes up about 1/4 of our revenue. So obviously, if the businesses are closed and everybody has to stay home, it's difficult for people to spend money and businesses to sell things. So I would anticipate our sales tax is going to take quite a hit. There's a silver lining to that, which is that our first quarter sales tax was phenomenal. It came in over, it was 11% higher than 2019. So if you have quarter 1 that's at 10% above last year, and then you have quarter 2 that's maybe 20 or 30% below, and then hopefully we have some type of recovery going into the 3rd and 4th quarter, by the end of the year we're hopeful that we'll be not off based on our budget by too much. The other thing to realize is that we always budget our sales tax conservatively. Last year, we received $1.4 million more in sales tax than we budgeted. The year before that, we received $1.2 million more in sales tax than we budgeted. So when you budget conservatively, you can afford to take a $1 million hit on sales tax because we weren't counting on that revenue anyways. It was going to be bonus. So sales tax is worrisome. It's something that we're keeping a very close eye on, but we don't know what those numbers look like because we don't get the check from the state until about 6 weeks after you walk into the store and make your purchase. So if you fill up your tank today in Lewis County, we're not going to receive that 4% sales tax until June. So it's hard to know right now what the impact is. The second thing that we have to worry about financially is state aid reimbursement. So the governor has been talking in pretty broad terms about 20% cuts for schools and local governments. We receive 15%, give or take, of our revenue from the state of New York. So a 20% cut in those programs would be difficult for us, obviously, but not something that we can't, overcome. What has to happen, though, is that we have to have a fourth stimulus package from the federal government that funds local governments. They've done 2 stimulus packages and have left out local governments twice. We are the ones that have the public health department. We are the ones that are doing the Medicaid and HEAP and SNAP and economic support applications during this time of economic strife. Local governments are providing the services. You talk about furloughs. It's hard for us to find employees. A lot of what we do is essential. We have people that have continued to work. So the federal government needs to act and help not only Lewis County but all of the local governments that are continuing to have these expenses when we know full well that our revenue is not going to match. So it's really, really important that there's a fourth stimulus package that steps up and provides some aid for local governments. So I hope that kind of answers your question in a long-winded way. Sorry.
With the state cuts that the governor is talking about, up to 20% for education and things like that, does that also impact like your the rate that you're reimbursed for like social services and things like that?
So
Medicaid.
When it comes to New York State, I always like to call it death by 1,000 cuts. So it's not going to be one thing that costs us $2 million. It's going to be, a little bit off from probation, a little bit off from mental health, a little bit off from Medicaid, a little bit on prosecution and court system stuff. And you start taking those one by one and they add up to be a big portion of our budget.
But things like the reimbursement rates for Medicare, Medicaid, social services, things like that, are they able to cut them?
Every single one of those programs has a different formula. It's not as cut and dry as you'd think. The state has some control over Medicaid. They have no control over SNAP, no control over HEAP, no control over Medicare. But Medicaid, we share responsibility with the state. Temporary assistance and safety net, which is a big program that social services does. Foster care, those are programs where state reimbursement matters quite a lot. Public health has programs where state reimbursement matters quite a lot in terms of pre-kindergarten and early intervention services. So I've just named 6 programs where the state has some hand in it. Not to mention Office for the Aging. We could name another 3 programs. So you start taking a little bit from each of those, and that's when we start getting into a situation where it becomes financially difficult for the county.
And as far as obviously with non-essential businesses being closed and tourism being down and things like that, those are all things that impact the sales tax portion you were talking about. But another big factor that people sometimes don't think about with sales tax is the gasoline prices. And with gasoline prices being about close to $1 or so less than they were maybe a year ago at this time, that could have a long, even after we come out and reopen and things like that the gas prices could be like behind that. So that could be another issue.
The last time we had low gas prices like this, well, maybe not like this, but the last time we had low gas prices was 2015. So I went back and looked historically at what our sales tax has looked like since 2007. So basically the Great Recession, through to today. There was a blip in 2015 and 16 where we just didn't grow what you would expect for the economic success we were having during that time. And the reason for that is because the gasoline prices were low. And so gas purchases is a large part of our sales tax, no doubt about it. And so I think that even if it were a normal year and we were seeing low gas prices like this, we would expect it to have some impact on our budgeted sales tax. Yeah.
Okay. Ashley, we've had a couple questions regarding, let me just look at my note here really quick. When it comes to non-essential businesses, pretty much according to the executive order, if their employees are able to work from home, they can work from home. But other than that, the location should be closed. It doesn't matter if you're doing social. It's kind of 100% of your employees have to work from outside of the location if you're deemed non-essential.
If you're deemed non-essential, then that is correct. Their business should be closed.
Okay.
Or working from home.
Okay. So is it public health? I know we've talked about this before, but is it public health that fields complaints on that, or the sheriff's office, or?
So the sheriff's office would follow up on complaints. We also have been following up and providing education to just make sure that whatever the complaint may be, that the individuals that are not complying at least have the information that they need. They're made aware. We provide them all of the education, but we do not enforce that public health.
Okay, and we have quite a few.
Before you go, switch topics on that one.
Same topic.
Oh, okay.
Go ahead.
I was just going to ask you if there's also the state hotline that people can call in with complaints. I know you've mentioned that in previous meetings as well. And then they contact you after they've investigated if there is an issue. Between those, they don't contact you, Ryan?
They do, but they don't investigate. They just send it fast.
They just send it fast? Okay. So between that and people contacting direct, how many complaints have come through in Lewis County approximately?
I would say we've received maybe 10 email complaints, which would be the ones that come from the state hotline.
Okay.
So what happens is you call the hotline, somebody from the state fills out an electronic form, and it gets automatically sent to 3 people, myself, Ashley, and Sheriff Carpinelli. I'd say we've gotten maybe 10 of those, of the formal. People calling informally, I don't know, 1 or 2 a day to my office, probably the same clip to Ashley's office. Yep. I couldn't speak to the Sheriff's Department. We still are pushing people, if you have if you think someone is violating the executive order is a law, and you can call the Sheriff's Department, 376-3511. It's the non-emergency number, and they're handling the enforcement aspect.
Okay, so back to my question. We have quite a few manufacturing facilities, especially here in Lavo. Obviously, some of them are deemed essential. Do you know are you guys provided with, if somebody's asked for a special designation to be essential, or do you have any understanding of, are all our manufacturers up and running right now here in the village? Would some places be considered essential even though people think they might not be essential?
So in the manufacturing facilities in the village are currently all running. Craft is food production, that is essential. Nina's paper products are used in masks and other essential personal protective equipment. AMF received a special designation from the Economic Development Authority, Empire State Development, to continue processing their current supply that they have.
So
that was the question. That's basically the question people were asking about the specific one.
AMF.
Yeah.
So I can expand on that. So the governor's executive order was very clear to keep people safe, but it also doesn't, the intent was not to destroy an entire business's on-site inventory. And so one of the provisions of the executive order was, even if you're a non-essential business, which of course bowling pins are not essential, but even if you're a not essential business, having an inventory that would be damaged by sitting outside like they have, and they also have, as part of their process, a glue where they are gluing wood together. If that glue is not, and I don't know the technical aspects of it, but essentially there's a time-sensitive nature between when you put the product together with the glue. If you let it sit too long, that can become warped. So they have to move through their outside inventory and through the process to finish in order to not lose that inventory, and that is allowed under the states.
So once the inventory they have on premises is completed, then they would go back to be considered non-essential?
Then they could work with Empire State Development to work on becoming an essential business, or maybe there's other aspects to their operation that we don't fully understand. But basically that would be up to them and Empire State Development to try to get essential business status, or explain why they would need to continue to operate.
When did they get that special allowance to?
I think when we started the Pause New York, so that would have been 3-4 weeks ago now. Yeah.
Any idea when their current inventory will run out? Have they talked about that?
No, we haven't worked directly with AMF. The business status questions are going through Empire State Development. I did have a conversation yesterday with Empire State Development just to clarify their status, and that's what I learned.
So you guys are made aware of when there's special designations given to businesses that are not normally considered essential?
No, we were following up on a complaint.
This one is changing topics a little bit, but
then before we do that, I've got one more back on the complaint thing. So the sheriff has said that in multiple interviews now that he isn't enforcing things, that it was the Department of Health. There are fines for infractions when they're found, up to, what is it, 2,000 now?
1,000.
1,000?
Yeah.
Okay. So if law enforcement says they won't enforce, doesn't that mean nobody's really worried about it?
No, it doesn't. I'm very worried about it. Ashley's very worried about it. Our Board of Legislators are worried about it, and we have been following up on all complaints that we've received. We are lucky to live in a community where people, by and large, are choosing to do the right thing. Business owners and business leaders are, by and large, choosing to do the right thing. We haven't had blatant disregard for the law like we've seen in other places, and I truly do believe that if we had a blatant large gathering that was troubling to public health, I think that the Sheriff's Department and all of our law enforcement partners would help us out to keep everybody safe.
Well, how would you define a blatant one, considering there was definitely large gatherings and law enforcement was around on the weekend? At most weekends at this point.
Yeah, I think people, I don't know. I haven't been up there to see it. We haven't received complaints through our ticket system or phone calls on that. I was frankly pleased the way Snert Run went last weekend.
Non-snert
weekend. That having, as I think your article described, a couple hundred riders was a pleasant surprise. We were expecting that there could have been 500 to 1,000, 2,000 people riding. So I think people have been respectful for the most part.
This is a great transition into
Wait,
my
I've got one more.
Okay.
So my last question on this particular topic is, what have the complaints been about in general? What have the topics primarily been, or the biggest? It doesn't have to be about specific business, but what kind of infractions have been involved?
Not wearing a mask is the topic this week.
For businesses.
Yes. That and non-essential businesses continuing to operate. And maybe just not fully understanding what is essential and what is not essential among the complainants as well. So.
Fair enough. Okay, thank you. Now, Nick, on to your segue.
All right. Well, actually, it had to do with the, I'm hoping you can help me out here with, usually we announce when the ATV trails are reopening in the spring, which we haven't done yet this year. And we've been getting a lot of people asking why we haven't announced that the ATV trails are closed. The reason for that is because they're still closed because they haven't been open for the season yet. But can you just talk to the ATV trail system, and is there like a projected opening date, or is that going to be on hold for a while, or?
So the local law governing our ATV trail system gives authority on opening and closing the trails to the Director of Parks, Recreation, and Forestry, which is Jackie Mahoney. I suspect that she'll have an announcement by the end of this week or next week on when we plan to open the trails. So the trails are going to be open, okay? So there's nothing wrong with going out for an ATV ride and enjoying nature by yourself or with a group that is socially distanced, okay? In fact, it's a nice, pleasant activity. We've all been cooped up inside, all winter long. The state parks are open free of charge right now. The state stances stay socially distanced, but also, it's healthy and for your mental and physical well-being to get out into nature as long as you are doing it in a safe distance.
Close to home and socially distanced.
Right, exactly. So we will have the trails open. I'm not sure. We'll have to ask Jackie, what the plan is. I think we'll have an announcement shortly. So the other thing is this. They would normally be open by now. We don't have our seasonal employees. We haven't brought on. We have trimmed our non-essential as well, and so we usually have a trail crew of 5 guys, and actually 5 people, including 2 women on our trail crew. That go out and prepare so that when the ATV riding starts, it's not tearing up and doing lasting damage. It's better to prepare before and have to clean up afterwards. So getting those trails prepared for the season and cleaned up from the winter is going to take a little bit longer this year. And I know that we have 1 or 2 people out working on that, but we usually have 5 or 6. So it's just going to be a little bit longer. We'll probably open trail by trail rather than, everything being open all at once. But we'll get there.
With those openings, then it's kind of back to, we were lucky with the non-snert that not as many people showed up, but a lot of people that showed up to ride, they weren't the locals, there was large groups from other places. And even, Flat Rock owner, he said the same thing. The bigger groups were all people that came up. They all talked about, when trails are open, we're coming up any weekend everywhere. Then we can ride even more. Like they were all talking about that. What are they waiting for with trail opening? Is that a risk? Could it defeat the purpose of social distancing when people are up more and more businesses are tempted to put out their picnic tables and various other things that are counterproductive and really in violation of orders? There's not supposed to be sit-down service. It's supposed to be take things away. So with all of those things, it's a very thin line between, but we really want to open up the economy and we can't, and what's putting us at risk. We don't have cases now. Is there, if we start to see an increase, would we change things, or?
I think Lewis County, like every place, is playing it by ear. We're reacting to the environment as it changes. We're reacting to the governor's leadership and the president's leadership as that progresses. So we are, we will have to address those concerns as they come about. In principle, getting our residents the opportunity to get outside and enjoy the natural beauty of Lewis County at a time when it is safe, as long as you're doing things the right way. I think that's appropriate right now. And if we start having issues with that, that'll be something that we'll have to address. But if you choose to live in Lewis County because of our, beautiful outdoor recreational activities and our trail system, and it's a beautiful sunny day, and there's a trail that runs by your house, and you want to go out for a ride by yourself, there should be nothing stopping you from doing that. Now, you can't stop at a restaurant with 50 people and hang out, but if you want to go out for a leisurely ride, that infrastructure should be open to you. So
then it follows the enforcement piece. When the trail's open, will there be an enforcement piece so people don't gather in parking lots in numbers or at restaurants and sit together and eat in public?
That will be, the sheriff's office, up to the sheriff's office to determine, how our law enforcement resources will be used.
Governor Cuomo has announced plans for approaching reopening the economy on a regional basis, not only with additional states, but regionally within the state as well. Does Lewis County have a position on this, and what are your thoughts on that?
The Health and Human Services Committee discussed this on Tuesday. Jefferson, St. Lawrence, and Oswego had co-signed a letter with Senator Ritchie's office supporting the idea of a regional approach to reopening the economy. We were not included in that because we're not in Senator Ritchie's district. We're in Senator Griffo's district. I think we will be putting out a letter based on what the wishes of the committee. We'll be putting out a letter basically stating our support, the Chairman Dahlhoff's support for a regional reopening strategy. So that should be coming shortly.
As a recreation and tourist destination, does it worry you to have different regions of the state opening at different times and having people from higher infected areas come into our area? Or
the governor has been very realistic about a reopening strategy, I think. Lewis County is bordered by 3 counties that are not in the North Country region. So opening up hair salons and golf courses and auto dealerships in Lewis County, or a DMV in Lewis County, when it's closed in 3 counties that surround us, it doesn't take a rocket science to tell you what's going to happen. People that are pent up and want these services from other areas are going to come to get those services from us. So I think there is a strong desire to allow areas like Lewis County that have not been hit as hard so far by COVID-19 to reopen in a strategic and intelligent way. But I think there's also implications of being neighbors to other regions that do have more cases. So I trust that the governor's office and the folks that we're working with at the regional level will make these decisions in a way that is strategic and smart. So yeah, it's a risk. You got to be a realist about what that's going to look like. But I don't think that's what it'll look like. I think it'll be more more strategic than that.
My last question is for Ashley, and it's just kind of an opportunity. I know you guys have been got some what's the word I'm looking for? Basically, you guys received some from other public health agencies in the state for your campaign for Make Me a Mask For. I make a mask for.
I wear my mask to protect.
I wear my mask to protect campaign. So that's something that you guys started out here in Lewis County. So can you just explain that campaign a little bit for people that haven't seen it yet, and kind of how it's been picked up by other agencies in the state as well?
Yep. So the campaign really started to encourage individuals to wear their mask to protect others, because again, it's about protecting others, not necessarily about protecting yourself. So the campaign showcases what individuals are wearing, or who individuals are wearing their mask for, if they're wearing it for their community, for their grandmothers, for parents, co-workers. So it's just a fun way to get people engaged to wear their mask when they cannot abide by social distancing.
Okay, and then you're sharing the photos on the public health Facebook page?
Yep, so if they use the hashtag hashtag I wear my mask. People can find them that way. They can also send them to us, and we have been sharing them on our page. And it has been well received. There's other county health departments that have duplicated this campaign to encourage people to wear their masks in their communities.
Do you know where they were? Which counties have joined the club?
Chemung, and I'd have to look back to get you the specifics.
Okay.
Sorry.
That's okay.
And as far as last thing on testing, I know we always have to bring up testing every time, but you guys are still comfortable with where we're at with testing. Supplies are still holding up well. You're able to test the people that need to be tested.
We are currently meeting the need. Again, it's based on what the public presents when they present with symptoms, and even with screening individuals for elective surgeries. We, at this point, have enough supplies. It's something that we're constantly monitoring and making sure that we're getting more in so that we can continue to test.
I should have asked Jerry this. None of the people that were that tested positive were from the hospital, like no staff members or clinic, none of that, right?
Mm-hmm.
Just in general, that's something people would want to and have a right to know if necessary.
Yep.
And the nursing home also, still no cases,
Correct.
nobody under quarantine there or anything
No.
at the nursing home.
Mm-hmm.
That's great.
Have there been any other positive cases related with craft of people that maybe live outside of the county?
No.
Okay.
Who's bringing the wine next time?
Jake.
Thank you.
All right, I'm all set. Thank you guys.
Thank